Okay. Alright, we're going to be seeing my patient today. Hello, my name is Annie. I'm going to be your nurse today. Can you give me your name and date of birth?
M-I-1-1-1940.
Alright, do you have any allergies?
Sofa.
Alright, we're going to be administering your meds again, so I'm going to wash my hands. Do you have any pain today?
No.
And have you eaten breakfast?
I'm waiting on it.
Sounds good. So while I'm in here, before I do your meds, I would take your vitals, and in an assessment, I'll listen to your lungs and your heart. So first, I'm going to go grab your medications from the MAR. Okay. We're going to come to the MAR. I'm going to do 3 checks, so I check it on the computer when I'm bringing up all the medications. And then when I'm grabbing the medications and scanning them in. So first, we are not going to give the sulfa. We'll call the physician because the patient is allergic to sulfa. We are going to be giving the cyanocobalamin, the B12 for the pernicious anemia. We are not going to be giving the atenolol because the blood pressure was already so low. We will be giving the fluticasone inhalation for their asthma. We will be giving the saline, and we will be giving the insulin aspart. So I'm going to get all my medications. I'm going to be giving the saline, and then the B12, and then the inhaler. My flush, you want 3 milliliters, and then my insulin aspart. Alright. And then the acetaminophen because the patient's fever was above 101. And then let me get my insulin needle and my B12 needle, and then my tubing. So I'm going to put this on here. I'm going to take all these back into the patient's room. I'm going to take my rubber butt. Then I would scan the patient's wristband with all of their medications. And each one. First, I'm going to start the saline because this comes first. I'm going to put my gloves on before I do anything. I'm just going to take my packaging off. For your insulin, do you have a preference in the spots?
My abdomen, but I got it on this side yesterday.
Okay, so I'll go on the other side today. Does that sound good to you?
Yes.
First, I'm going to clean your site. Okay. I want to do this for at least 15 seconds. Make sure everything's clean. I'm going to get my flush. Making sure not to touch anything that's going to go in the patient. Are you doing okay? Yeah.
Yeah, I'm doing great.
I'm going to do 3 milliliters. First, I'm going to open this. There we go. Okay. Are you having any pain?
No.
Okay. I'm going to keep this because for reasons that we don't have anymore.
That's the truth.
Okay, then I'm going to hook up the tubing. Making sure not to let the tubing touch anything. make sure we fill the. Make sure there's no kinks in our line. Sorry.
It's okay.
Okay. I'm gonna let the drops run for a minute. I wanna watch it. Put it over the trash can. Make sure we do 14 drops per minute. I'm going to clean it off. Make sure there's no those. I need to clean it off first. Okay. Some twist off. Alright. We'll pick that up later. Okay. Watch it for a minute. Your saline is good. After that, I am going to do your injections. So we're going to start off with your B12. So I'm going to clean the top of my B12 and then the rubber bud. So I'm going to open this without taking out anything of the person. And we will be doing 2.6 milliliters of the B12. So I'm going to pull back 2.6 milliliters of air. So I'm going to go straight in at a 90-degree angle. After that, we are going to do our insulin. And the glucose was 242, so we're going to add 4 units to their original 12, making it 16 units. So I'm going to draw up 16 units of air. I'm going to have the nurse verify that this 16 units after I get the medication in. Can I have the nurse verify?
16. Yep.
All right. So my rubber butt is clean from before. So I'm going to pinch it, go to 45-degree angle. And as we said, we would put it on her abdomen in the spot that she did not have it placed yesterday. Put it in the sharps. So after that, all she has left is her inhaler and her acetaminophen. So I'm going to teach you how to do your inhaler. You already know. Shake it up. Take a deep exhale out, and then you're going to breathe this in. Hold it as long as you can, then wait 1 minute. You're going to do 2 puffs. Okay, like that. And then I'm going to do your acetaminophen. This is for your fever. So because of supplies, I'm not going to open it. I'm just going to give it to the patient. Pretend that the patient took it. Okay, thank you. So after administering all their drugs, I'll read the side effects for each. And then I'm going to give you your oxygen before you leave the room because your O2 stat was at 90. So your B12 is for your pernicious anemia. We can give you abdominal or stomach pain. Your inhaler can give you nausea, vomiting. Your saline, you could just have irritation at the site, let the doctor know if you have any of that. Your insulin is for your type 2 diabetes, can cause weight gain, constipation, itching at the site. Your acetaminophen can cause nausea. After this, I'm going to give the patient their nasal cannula for their oxygen. And then after that, after giving all their medications, I would check their vital signs again, make sure that their fever is coming down, and then that their oxygen stats are coming back up. Here's this. And then I would let the doctor know we administer all the medications, check back with the patient in like an hour. Okay? Did I forget anything, dude?